At 56, David still hiked 5 miles every Sunday without breaking a sweat. Then his blood pressure reading crept into the danger zone, and his doctor prescribed a small white pill to take each morning. 3 months later, David could barely make it up the stairs without pausing to catch his breath. He blamed it on getting older. His friends told him to expect it. But the real culprit was sitting in his medicine cabinet, quietly sapping his energy one dose at a time. If you are over 55 and taking blood pressure medication, there is a good chance you are on one of two drugs, amlodipine or metoprolol. Both are prescribed millions of times each year. Both lower blood pressure effectively. But one of them is far more likely to leave you feeling like a shadow of your former self, and most patients have no idea which one they are taking or why it matters so much after 55. The change starts subtly. Maybe you notice you need an extra hour to recover after your usual walk. Perhaps you find yourself dozing off in your favorite chair at 3 p.m. when you used to be wide awake. You assume it is just part of aging, but your body is sending you a warning signal that your medication might be working against you in ways nobody bothered to explain. High blood pressure is not something to ignore. It is a silent killer that damages your arteries, strains your heart, and increases your risk of stroke and heart attack. But here is the truth your doctor may not have time to tell you. The way your body responds to blood pressure medication changes dramatically after 55, and what worked perfectly in your 40s or 50s can become a liability in your late 50s and beyond. Your arteries are not what they used to be. With age, they stiffen and lose elasticity, making it harder for them to expand and contract with each heartbeat. This stiffness drives up your systolic blood pressure, the top number in your reading that is most strongly linked to heart attacks and strokes. At the same time, your liver and kidneys, the organs responsible for processing and eliminating medications, slow down. Drugs stay in your system longer and at higher concentrations. A dose that was safe at 50 can become excessive at 60 without anyone adjusting it. Your heart also becomes more sensitive to medications that alter its rhythm or rate. These changes mean that the blood pressure medication you have been taking for years might now be doing more harm than good, and the first sign is often a creeping fatigue that you mistake for normal aging. Now let us look at the two medications in question. Amlodipine and metoprolol work in fundamentally different ways, and understanding that difference is the key to knowing which one might be draining your energy. Amlodipine is a calcium channel blocker. Here is what that means in plain English. Every time your heart beats, calcium flows into the muscle cells of your artery walls, causing them to contract and tighten. That tightening creates pressure. Amlodipine blocks some of that calcium from entering those cells, allowing your artery walls to relax and widen. The result is lower blood pressure with less resistance for your heart to pump against. For seniors, this mechanism has a particular advantage. It directly addresses the arterial stiffness that makes high blood pressure so stubborn and dangerous as we age. Studies have shown that amlodipine is highly effective at lowering systolic blood pressure and reducing the risk of stroke in older adults with coronary artery disease. Metoprolol, on the other hand, is a beta blocker. It works by a completely different mechanism. Your heart has receptors called beta-1 receptors that respond to adrenaline. Every time stress, exertion, or even standing up sends adrenaline through your system, those receptors tell your heart to beat faster and harder. Metoprolol blocks those receptors, slowing your heart rate and reducing the force of each beat. This lowers your blood pressure by reducing the workload on your heart. For people who have had a heart attack, have heart failure, or have certain types of irregular heartbeats, this protective effect on the heart muscle can be life-saving. Metoprolol reduces the oxygen demand on a heart that is already under strain, making it an essential medication in these cases. But here is where things get interesting. For straightforward high blood pressure in otherwise healthy seniors, metoprolol is not typically the first choice. Major clinical guidelines often prefer calcium channel blockers like amlodipine for initial treatment in older adults with uncomplicated hypertension. Why? Because while metoprolol is excellent at protecting the heart in certain conditions, it comes with a significant downside for many seniors: fatigue. And not just ordinary tiredness, the kind of exhaustion that makes you feel decades older than you are. The reason is simple. Metoprolol slows your heart rate. For some people, this can be too effective. A heart rate that drops too low can leave you feeling lightheaded, dizzy, or utterly drained. Many patients describe it as a heavy, oppressive tiredness that does not go away with rest. It is not just in their heads. Studies have shown that beta blockers like metoprolol can cause fatigue in a significant percentage of patients, and the risk increases with age. For seniors who are already less active, this side effect can be particularly devastating, leading to a downward spiral of reduced mobility, further fatigue, and a diminished quality of life. Amlodipine, by contrast, does not typically cause this kind of fatigue. Its most common side effect is peripheral edema, swelling in the ankles and feet. This happens because amlodipine relaxes arteries but not veins equally, causing fluid to pool in the lower body. While uncomfortable and potentially a fall risk for some seniors, edema is generally not as debilitating as the fatigue caused by metoprolol. Some patients also experience flushing or mild dizziness when standing up. But these side effects are usually temporary and manageable. But the story does not end there. Both medications come with their own set of risks, especially for seniors taking multiple prescriptions. Amlodipine is processed in your liver by an enzyme called CYP3A4. This same enzyme is responsible for breaking down many other common medications, including certain antibiotics, antifungals, and even grapefruit juice. When these substances interfere with CYP3A4, amlodipine can build up in your bloodstream, increasing the risk of side effects like swelling and dizziness. Metoprolol, meanwhile, can interact with other heart medications, such as digoxin, or with additional blood pressure drugs, potentially slowing your heart rate to dangerously low levels. These interactions are not rare. They are happening right now in millions of seniors whose medication lists have never been reviewed as a whole. So, which medication is safer for seniors? The answer depends on why you are taking blood pressure medication in the first place. If your primary issue is high blood pressure caused by stiff, aging arteries and you do not have an underlying heart condition, amlodipine is often the better choice. It directly targets arterial stiffness, reliably lowers systolic blood pressure, and is less likely to cause the kind of fatigue that can rob you of your energy and independence. Metoprolol, on the other hand, is typically reserved for situations where the heart itself needs protection, such as after a heart attack, in cases of heart failure, or for certain arrhythmias. In these scenarios, its ability to slow the heart and reduce its workload makes it essential, even if it comes with the risk of fatigue. But here is the critical point. Neither medication should be taken without regular review. Your body changes as you age, and so should your treatment plan. What was appropriate at 55 may not be at 65 or 75. The average senior takes 4 or more prescription medications daily, and the risk of interactions increases with each additional pill. This is why it is so important to have a complete medication review with your doctor at least once a year or whenever you notice a change in how you feel. If you are taking either amlodipine or metoprolol and have been feeling unusually tired, here is what you need to do. First, do not stop taking your medication on your own. Sudden withdrawal, especially from metoprolol, can be dangerous. Instead, schedule an appointment with your doctor to discuss your symptoms. Bring a list of all the medications you are taking, including over-the-counter drugs and supplements. Ask your doctor these 5 questions. 1. Is this medication still the best choice for my current health status? 2. Could any of my symptoms be side effects of this drug? 3. Have you reviewed my complete medication list for possible interactions? 4. What is my target blood pressure, and has it been adjusted for my age and overall health? And 5. How often should we reassess whether this medication is still right for me? Let me tell you about Robert. At 62, Robert was an active golfer who walked the course without a cart. After starting metoprolol for high blood pressure, he found himself exhausted after just a few holes. He assumed it was just part of getting older, but his daughter, a nurse, suspected his medication. She encouraged him to talk to his doctor, who switched him to amlodipine. Within a few weeks, Robert's energy returned. He was back on the golf course, walking all 18 holes without a problem. His story is not unique. Many seniors have found relief from fatigue simply by switching from a beta blocker to a calcium channel blocker under their doctor's supervision. The takeaway is clear. If you are over 55 and taking blood pressure medication, do not assume your fatigue, dizziness, or swelling is just a normal part of aging. It could be a sign that your medication is no longer the right fit for your body. Talk to your doctor. Ask the right questions. And remember, the goal of treatment is not just to lower your blood pressure, it is to help you live a full, active, and energized life. Your medication should be working for you, not against you. High blood pressure is serious, but so is your quality of life. Do not let a prescription rob you of the energy and vitality you need to enjoy your golden years. The right medication, at the right dose, can lower your blood pressure without draining your energy. And that is a choice worth making.